Thank you.
Thank you. Dean Matthews, distinguished faculty, administrators, dignitaries, family, friends, and of course my fellow graduates. It is an amazing privilege and my greatest joy to stand here before you today representing the 2012 graduating class of JFK Muhlenburg and Harold B. and Dorothy A. Snyder School of Nursing. We have come from many different walks of life. The single or married parent, waitress, hairdresser, or custodian, the student with many financial loans, the male student, and others who have overcome stereotypes, hardships, and adversity. But together we became a team. We became friends. And we survived many stumbling blocks to achieve a dream that many of us at times thought was unattainable. We have worked hard. We have been absent from family functions and celebrations. We did not return phone calls, and we have forgotten to pay a bill or two. We have listened to our children, spouse, or friend talk about their issues of the day, but then realized we had no idea what they had just told us. We did all this because we had been following our passion. When we had finished our last final, I had decided to get in touch with a dear friend of mine that I had not spoken to in months. She actually answered the phone by saying, "She's alive!" Florence Nightingale offers the following wisdom. Nursing is an art. If it is to be an art, it requires an exclusive devotion, as hard a preparation as any painter's or sculptor's work. We began by working very hard to learn this art of nursing, a whole new language with many abbreviations. Who will ever forget from the Nursing 1 final what BRP is, bathroom privileges, or ADL's activities of daily living, or SOB, which is not the patient in room 201 who keeps ringing the call bell every 5 minutes. It really means short of breath. We learned about the need for air, activity, nutrition, and sleep, although we didn't always practice these on ourselves. We learned about always meeting the standards of care, never ask a patient why, and always have the patient's food tray on the floor before we give insulin. We now know it's all about perfusion, and that pain, well, pain is what the patient says it is. We spent many long hours in lecture hall and with skills practice, which eventually transitioned into actual practice of this theory and skills application. Who among us will ever forget the fear and anticipation of caring for our first patient? Each of us have memorable moments with patients that we have cared for. At the end of my very first clinical day, the first patient I had ever cared for, a frail, elderly woman in a nursing home, took my hand, looked me in the eye, and proceeded to tell me that I would do well and I would be a good nurse. At that time, I was unable to even dream of standing before you today. That patient, along with others, will forever leave an indelible mark in my heart, as I am sure you have had patients affect you similarly. Our instructors have given us a strong foundation to build our career as registered nurses. Each of you, in your own special way, has given us the knowledge and the tools to move forward as a registered nurse. You have taught us how to write and execute a proper care plan, how to insert a Foley without breaking sterile technique, to gather all our supplies and extra equipment before we enter the patient's room. You have taught us what information we must know before we administer medications to our patients, and you have insisted that our skills be practiced, performed with accuracy. You have guided us through those dreaded APA format papers, and you've taught us to never deviate from the standards of care, to always look at the patient first, and don't forget to step back and look at the whole picture. We thank you. Our spouses, significant others, family, and friends have all given us sustenance to continue. You have given us support and encouragement. You have been there when we rejoiced with accomplishments You have held us when we cried with anxiety, frustration, and a less than perfect clinical day. This journey that we have endured has been an arduous one. We have fought hard to climb this mountain, and we have done it with your love and support. You helped us strive for this endeavor, and we thank you. You are one of the major reasons that we can stand before you and call ourselves graduate nurses. On behalf of my fellow graduate nurses, I can say that we stand before you tonight ready to embark on our journey into the nursing profession. We are ready to put into practice what we have learned. We are ready to care for our patients with compassion and comfort. We will hold true to what first inspired us to want to care for others. We have fought hard, studied hard, and have undertaken this task with humility and grace. As a member of the 2012 graduating class, I am proud to be a part of this class and to share in this achievement with all of you. In closing, I leave you with the words of Mrs. Wolf, our Nursing 1 instructor. The patient in that bed is your mother, your father, your sister, your brother, your best friend. Always remember that. Thank you very much.
Congratulations, Kathleen. That was a special oration. It reflected some real wisdom. And thank you very much, and congratulations. This really does seem to be a special class, Dean Matthews. I get really nice vibes from this group. I hope we get to keep a bunch of them. I don't mean left back. I mean, you know. So, lighting of the candles?